So today we're going to talk about, is TMS therapy covered by insurance? With me today, I have Dr. Kevin Murphy. Doc, can you tell us a little bit about who you are?
Thanks, Kyle. Yes, I'm an oncologist by training, specializing in pediatric and adult brain tumors with a process called radiosurgery. And the last 10 years, I've spent time working on a personalized approach to transcranial magnetic stimulation.
So Doc, can you tell me a little bit more about this?
There are a few indications that are covered by insurance, typically major depression disorder, and a few new indications of OCD, obsessive compulsive disorder, and some migraine patients can be cleared for insurance. Right now, patients may have other morbidities, other problems, and also have major depression disorder. As long as major depression disorder is a part of their diagnosis, most insurances you can apply for coverage.
Okay. And so it's really working with your psychiatrist and going through proper paperwork, obviously, to submit to the insurance company.
There is. Most insurance providers require a psychiatric evaluation
Right.
to document that you have major depression disorder. They oftentimes also want you to have failed other remedies like other medication management. That's getting varied amongst different groups. Some want one drug, some want 3 or 4 drugs
Right.
to have been tried first. So that's a typical process for TMS, standard
Okay.
TMS authorization. In our world, using personalized RTMS, personalized TMS therapy, we're using the same device, the same equipment, and the same medical process of magnetically stimulating through the brain, but we're adjusting the protocol based upon the patient's response. So in all medicine, we personalize our therapies by adjusting our dose based upon the response to therapy. If they get better in a certain way, or if the waveform changes in an appropriate function, we follow the lead of the brain.
Yes.
So we amplify proper brain signal and try to remove noise. And that requires a weekly protocol, which is adjusted based upon those responses.
And so it's just going back to the insurance company on a weekly basis and informing them we're changing these, or we're increasing these protocols according to the client's progress.
It's really about the authorization. We declare this up front to the provider. We are going to be adjusting dose based upon the patient's response.
Right.
Which is how we do all medicine. So it's not anything new to the insurance provider.
So currently, is PRTMS being authorized by insurance?
So we have some providers across the country that are doing just that. They're doing regular codes for RTMS, but they're just declaring that they're using a personalized approach.
Using the PRTMS.
And there are some
protocol.
providers that accept that, and some providers want the standard.
Yes.
And so it just depends on the provider, but we're seeing more and more acceptance by
provider
providers.
and insurance company.
Insurance,
I'm guessing,
insurance, yeah, insurance provider.
Right.
You're seeing more of those insurance providers becoming open to the idea that we can adjust the dose here, like all doctors adjust dose.
Well, I'm sure with the benefits, I mean, they would be happy with the fact that the client is getting better, no?
Yeah, I think we can document now on the electroencephalogram that there's improvement.
Right.
We can document on their neuroscores when they take their subjective tests that they're improving. So they're getting both data sets that show the patient's improving. And I think they like that. The insurance providers seem to like more data. So
which, I mean, from the sounds of it, you're getting more than just the GAD-7 and the PHQ-9 standard scores that a normal TMS facility is giving you anyways, right?
Well, most general TMS standard providers are not even doing neuroscores per se. So they're just treating one location with one frequency, and they're monitoring patients in various ways. We like to have, we have 40 or so different standardized neurological tests that our patients can take. Those same tests are taken every week.
Okay.
And we watch the change in their score, and that information goes back into our computer system and drives the next protocol. So it's going to be both, is the patient responding better clinically, and is the waveform changing in an appropriate way? Both those things drive the equation to alter and to sort of fine-tune the protocol. And that's done weekly, every five treatments.
Hey guys, if you found that video helpful, do me a favor, click on this one right here. You'll really enjoy it. Did you click it? Click on it. You're going to love it.